Why have I quit my job? Why have I, bought a van? And why am I going to drive around the country? Well, I'm passionate about the idea that you need to be heard. And I want to stitch these stories together across the states. We're going to find the commonalities. And it's going to be really an amazing experience. And I look forward to you joining me on the jar.
Hello, everybody. Welcome to a special edition. I can call this a special edition of Mental Health Today. My name is Ken Stearns. I'm the host of this show. I'm also the host and the creator of the Jar podcast, which you just saw a little commercial. That was me about 16 months ago, prepping my van for the trip around the country, 111 cities, 444 interviews. And, out of that, halfway through that, really impressed, maybe the wrong word, impressed with the mental health crisis in America. We had, I left the country and things seemed to be okay 20 years ago. And I came back and y'all messed it up. And there's a big mental health crisis going on around. And as I traveled, I was just really, I was overwhelmed with the struggles people were having. And not just the struggles they had, but the journey to get help and what that looked like and the timing of it. And there's just struggles with really getting the right help at the right times. And most people did, I have to say, almost all the people that I talked to really did find a therapist at some point, and that person made a difference. And a lot of them still in with a therapist. So it is it works. I mean, I think that's the thing we can say. And it's the system of getting people the help, making it more available. Not crushing therapists with back-to-back appointments and all the things that we see happening right now that are making it difficult. So I started the JAR Foundation in hopes of, finding a way that we can help on my side at least, and try to see. I've always been good at raising money and raising awareness, so going to put my money raising efforts, where my mouth is, and see if I can do something and make a little impact somewhere in my corner of the world. With the JAR and the travels and the people that we meet. And quite often they are taking their experience and really, in some cases, cashing out on their previous life and converting everything into the lessons that they learned along their mental health journey to recovery and doing the work to improving themselves. So I've been super inspired by that, by some people just throwing everything away to go help other people. And so that's also part of the reason. And that ongoing, the ongoing conversation here, more than 50 shows now. LB and I met, and we had a great chat. And I was saying, this is something I kind of had an idea of, is to have a group chat, is to really bring a little panel together of professionals. And I think, LB, this is great because it is this interdisciplinary, or I don't know, is that the right way to say it? With the fact that you've got a lot of people from one area, but also different expertise. And I think that's just unique. So maybe, why don't you guys, you ladies, I'm from Chicago. We always say you guys. We were pre-pronoun stuff. We already had it in Midwest. We called, we just put everybody, you guys. The ultimate pronoun language, the ultimate just completely misguided. So how about some help and some background of where's everybody from? Not say from, but what do you, as far as your background of what you're working on now? I think your backstory less important here, and more about, again, what you're currently working on, what you see in trends, both from clients and both from the support side too, as we talked a little bit about, the insurance industry and the government. Are we seeing? There's a lot of talk, on the government side, insurance side, but is there any action and change?
Yeah, I'll go ahead and just start off with just saying my credentials. I'm a clinical social worker, a certified financial social worker, and a perinatal mental health certified practitioner. So I'm from Alabama, so I've only practiced in Alabama, and we are blessed in a lot of things, or not great at a lot of things. So that's where I am wanting to come in to, like you mentioned earlier, kind of changing our past through experiences. Worked in an outpatient medical facility, loved it, Like I had to shift and pivot through my experiences, and then and so now, as you're talking, it is that direct work with clients, and but also it goes deeper than that. And we know things work. We know things, certain therapies work, or what people need, but you have to prove it. So research wise, or show to insurance. So I am going to embark on some research for access to maternal mental health. So that's a little bit about me. I'm going to throw this to somebody else to share who they are and how this is, multi and interdisciplinary. I'll go to Stacy or to Stacy.
I think we should tag somebody when it's time.
Anastasia, you got it, girl.
So, hi, I'm Anastasia Rogers. I'm also a clinical social worker, and my main focus is the more of the trauma approach. And the reason that being just because from my experience and over the years, I've just come to realize that a lot of coping mechanisms, more of depression, a lot of anxiety, a lot of that all stems from some type of trauma. And so that's kind of the journey I embarked on, getting trained in EMDR, and that I found to be very helpful. Also working with professionals, doctors and neurologists who do TMS, and kind of collaborating with them so we can get a very holistic approach for our patients, not just on the chemical side, but talk therapy, and then the processing of the trauma, and then, the medication as well. So integrative approach, but more focused. My expertise would be on the trauma part of it.
And so TMR and TMI, give us a short
TMS?
Yeah, sorry, TMS. Give us a short explanation on that.
So that's transcranial membrane stimulation, and basically that's what the neurologist will do, and it's really a new form of treatment where they put electrodes on your head and send stimulation into certain parts of your brain, which kind of triggers that part of your brain to do what it's supposed to, which then kind of sets off that chemical imbalance and balances things out. I've seen a lot of good research with some of my clients who have been doing that, but my focus would be on the EMDR side.
Okay. Okay. Interesting. Didn't even know that was a thing.
Yeah.
Okay. You got to tag somebody. You have to tag somebody.
Andrea.
Okay, fun. So I am a licensed professional counselor. So a little bit different training from both Anastasia and LB. My training was more, I think, individual, just to kind of compare and contrast training perspectives. But I do direct work with clients as well. And my focus is also clinically on trauma. I do a lot of work with what we call complex trauma, which tends to be having multiple traumatic experiences over the course of your life, typically starting in childhood. I'm also trained in EMDR as well, and I utilize that a lot with my clients. I'm also sort of on the flip side, looking at another, I guess, side of mental health. I have a lot of focus on counselor burnout and just the ways that impacts the field. Because if the clinicians are not doing well, then we can't serve our clients. We can't be there for people. So I'm actually getting my PhD in counselor education right now, and doing my dissertation on counselor burnout and recovery, and just
and that's your dissertation.
That's my dissertation.
Wow,
yes.
That's pretty good timing. You got pretty good timing, because I think it's a hot topic.
Yeah, it's I've seen it. I mean, I've experienced that myself, and I feel like just about every clinician that I have talked to has experienced some level of it, and it's really difficult. A lot of people leave the field because of that, and I think one of the big issues with like the mental health crisis partially is we don't have enough clinicians in the field, so everybody is overloaded and wait lists and those kinds of things. So hopefully, figuring out a way to help out with that side of it.
If I do 2 jar sessions in a day, honestly, I need to stare out the window for an hour. I need to play guitar. I need to play guitar, sit out there and just like let my brain just melt. I cannot imagine what you go through seeing 6 patients in a day or 8 patients in a day. You are like, it's front line. You're on the front line of a battle. I mean, you're really literally on the front line. Ria?
Yes, so I'm glad that Andrea went before me. Because
Why?
because Andrea is kind of like the head of Hope Grows. And so I actually came to Hope Grows as an intern originally in my training. And I am now a licensed marriage and family therapist associate. And
congratulations.
Thank you. And so I'm a little bit newer to the field. But as Andrea was saying, kind of like the differences between our different disciplines, the way marriage and family therapists tend to like visualize their clients is through a systemic approach. And so I think social workers do that too on like a larger scale, but marriage and family therapists see it as like the client is part of their like relationships. Okay. And so I see clients pretty much ages 5 to 90 plus. And I also see couples and families. And so I kind of see kind of the gambit of all of them. I'm also EMDR trained because I find that having a trauma tool is really important in your toolbox. And other than that, I do play therapy. I do CBT, DBT, all of those fun things that I think LB and Anastasia and Andrea do as well. So just another way of visualizing our clients.
What are you all seeing? What change have you seen in the last few years? The clients, what's the biggest shift in, I'd say, the cause? I don't know if it's a cause or is it the symptom? I'm not quite sure how to ask the question. But what are you seeing the manifestation of or people coming to you that's different than it was a few years ago?
I think after COVID, what I've seen a lot of is more people are actually open to seeing therapists, especially male clients. And I think just being in isolation, realizing how much we need that interaction and how much we need to take care of our minds. A lot of people have kind of been forced in some ways to see a therapist, and then realizing that, hey, this is actually really beneficial.
Actually, I'm learning. Yeah, this is actually a pretty good thing.
Yeah.
Okay, so it's that you think it's some self-reflection, some time for some, and okay. Yeah, I don't want to say anything else. So I'll let everybody else kind of chime in.
Yeah, I was thinking too, kind of like an awareness or a destigmatization that's occurred for the mental health field. People that have said to me many times that they would never come to therapy are sitting across from me, and I'm like, well, you made it.
We must be in Neverland.
Yeah, but I think it's just people being more aware of what anxiety is, things that they're like, well, I've dealt with that forever.
Yes, yeah.
But being able to put a name to it and being able to realize like, oh, people do things about this. There's tools to be learned.
Yeah, putting a name to it makes a lot of sense. And then, then I can find out what I can do with that. At least I'm holding on to it.
Yeah.
JB?
Yeah. Oh, so I think COVID really exacerbated a lot of things, mental health things, whether people could keep it under the radar. And then after that, it was just really, we need support. And I think also with that, the only one, if you had to look at the positive of this, virtual, being able to access mental health therapy and resources virtually, which some practitioners were doing that a little bit before, but not at the scale that it is. And so I've had a lot of clients that, they're like, I'm just trying this for the first time because nobody in my family, we don't talk about this. We don't, they don't. And in fact, on the intake, one of the intake, part of the intake is like, are there any other family like diagnosis in your family? And it's like, and half the time I'm like, well, I know we don't talk about it, so people don't know, we just don't talk about it. So like, I'm like, shut this question out, but no, I need to ask. But So there's that. And then just isolation. I feel like a lot more isolation, a lot more financial stress. See a lot of, in my training and opinion, I feel like there's a lot of things connected to finances or lack thereof, or management. So there's that as well. You know, you think about losing your job or addictions, you know, and things like that. So, yeah, but I think it has been, it's been destigmatized a bit.
A bit, yeah. Yeah, especially I think there are different parts of the country, different impact on the stigmatization. Yeah. And I think it's definitely regional. It's got a lot, and then culturally within different ethnic groups, different religious parts. I think, you know, there's different depths of it.
Yeah. And I will say a lot of people, one, do not know that social workers can provide therapy. So I've had it multiple times, like, oh, you're what? And I'm like, yeah, I'm a social worker. But then a lot of people didn't know what therapy is. It's like, it was like, okay, it's medication, it's a doctor. Some of my clients think I'm a doctor, and I'm like, no. You know, it's just like in this, I don't know, it's just the idea of therapy is just like hardcore, and it's really, you know, it is hardcore in a sense of like, okay, we don't have the answers, but we're going to talk you through your answers because you're the expert trying to find it. And some people have a hard time. So.
Also,
self-talk is not a thing we learn.
I also like the fact that you brought up the minority groups. And I think that's one of the groups that I've been seeing a lot of are, you know, African-American, Hispanic, and again, in this situation, the minority group would be male because males don't.
That's also, also in your industry, getting the men. I mean, let's face it, getting the men to come see somebody or to flip on the computer screen.
Right. And that's been a huge increase recently. And the hush hush, we don't talk about our feelings, especially with men. That's definitely taken a turn, and especially the younger generation just coming into therapy just to talk about relationships or you know, issues with their families. And I've seen a lot of that, which is great for men because we're creating a more secure future, emotional secure future for our young men.
If they learn how to talk and communicate their feelings, emotions.
Right.
Yeah,
Andrea?
I think sorry, go ahead.
Yeah, it's good. Yeah.
Oh, I was just going to say part of that, I think, is a lot of social media. There's tons of platforms now, you know, within TikTok, Instagram, Facebook, whatever, that's raising awareness of, you know, some things that people will come in and they'll be like, oh, I think I have this or that. And it's like, oh, well, I think we'll have to dig into that a little bit more, but it's starting the conversation.
Yeah, it's good.
You know, and it's making people realize like, oh yeah, like there's a huge therapy platform out there on these different social medias. And I think that has also been helpful for bringing people into the office.
Yeah, and helping people at least have some idea what the definitions mean.
Yeah.
So they're coming, you know, because we all know, you know, if you go in to see a doctor, you've got a pretty good idea on some of the stuff, what it means and what the diagnosis and treatment. But for mental health, it's probably a black hole for most people. You know, what's the difference between depression and anxiety? I could ask 100 people on the street corner of New York. You'd get 100 different answers. Probably none of them right. Unless I ran into one of you guys.
Yeah. I mean, it's so different for different people, how it presents. And this could be misdiagnosed in the sense of not understanding what.
Well, I saw it on TikTok. I know I got depressed.
Yeah, you're right. Yeah.
You're gonna have to Gia's going to have to convince me otherwise. Andrea, what are you seeing?
Yeah, I think I agree with everything that everybody else has said. I think it's sort of I hate to say pros and cons, but sort of like a downside and a silver lining, I guess. Like the sort of silver lining is that therapy seems more accessible now because we are pretty much every clinician I know offers, telehealth services. So people who weren't coming in before, they're able to come in now, just because it's easier. You can just log onto your computer and see your therapist. So that's really nice. It's been very much destigmatized in a lot of ways. Like mental health has become more of a mainstream conversation. And even, like what Ria was saying, when people come in with, I think I might have this or I might have that, like they may or may not be right, but they've gotten in the door and they're having the conversation. So I think that's huge. So many people who are understanding their trauma history that they didn't really look at that way before. They didn't realize that they had trauma, but it's been causing a problem for their entire lives potentially. And hearing other people talk about it, they start questioning their own, past and going, wait, actually, maybe these things did have a bigger impact on me than I was realizing. And maybe that's why I've been having problems with my relationships or, whatever it may be. So I think all of that is really wonderful. I think on the flip side, though, I have noticed so many of my clients, like whatever they were dealing with before, it has been exacerbated just in the last few years, with COVID. And then, I mean, all of like political stuff. And like, there are a lot of systemic issues in terms of like getting access to care, and not just, seeing a therapist, but also say getting the medication that they need, having those referrals and being able to see those people, those providers in a timely manner, things like that are really difficult. And just like having to carry the extra load of all of this additional stress, from everything that's been going on in the world, on top of, their depression or their trauma or their anxiety or whatever they would have already had going on. So people just are carrying a heavier load in general. And I think, so everybody's just having a harder time, and that part sucks.
Yeah, and it's coming, and then I think you combine it with, I think what everybody else said about, stigma going away a little bit, access getting a little bit, like you were saying, access. And so we see, with the limited number of professionals we've got to service everybody, you see more demand, right? More demand. I think it's been about almost 2 years. It's certainly 18 months. President Biden signed a 7-point plan to address mental health. A couple of the interesting ones. One was was integrating health and mental health into the health insurance practice, and making sure that we've got this, kind of this dual approach, right? Instead of, it's for me, my 15 minutes in the space, I'll sum it up to this, which is we've got this really good health care system, which is really good at treating symptoms of other things. So after, so we're allowing people to let their minds, destroy their bodies and physical ailments. A lot of the stuff that happens in healthcare is a manifestation of something else. And a good chunk of that is definitely related to mental health.
That makes me think about like the ACEs, the adverse childhood experience.
Yeah,
it makes me think about that. That is mind-blowing.
It's mind-blowing, the amount of, and so mental health is preventative health. This is really one of the only true preventative healths that I know of. A lot of the other stuff is not real, it's preventative health sort of, but this is literally controlling your mind, which can make your body heal your body possibly, or can make you obviously sick. What are we seeing? Are you seeing anything? Are any of these initiatives kind of coming through the government? Are you seeing a tie to healthcare? Are you seeing anything billing? Is billing getting easier? Are they, pushing anything through to make your job easier, or do you think it's going to go the other direction before it gets there?
I know that they had several projects and grants which were implemented at several FQHCs, which are the clinics to help the underserved population, which was aimed at more of a holistic, integrated approach where people could get all their symptoms / causes treated at the same place. But I'm not sure about up north, but in Alabama, insurance part doesn't really pay out what they need to pay out. And so it's hard to keep, the clinicians. And so that a lot of the problem comes down to insurance, and the insurance not working with the great ideas that we have. Especially, I can't speak for any other state, but I can speak for Alabama and how they've tried to implement it several times, make it work, but unable to keep clinicians, because clinicians have to eat and keep a roof over their heads as well. And so it's more on that level where the barriers are coming in.
Yeah, it's tough. This one worries me. Usually the government gets involved and it turns into a shit show for 15 minutes before it gets fixed. I'm just hoping that they get it right. I like the stuff they're doing, which is integrating the medical health in there, and then also there's a push to, one of the other things is that in that strategy is to drive it through employers, is to drive tools and education through employers. And I think that's a brilliant way to go. It's a great way to reach a lot of people, and people with insurance and people with money. So we can impact, there's underserved people, and there'll be a channel for that. But I think, a good chunk of people with money, with insurance, with a job, these are really, and they're all in one place. We can really affect change through that if we can get it right. If we can get it right.
Yeah.
How about some other experiences?
Yeah. I have more negative than positive.
Yeah, it's okay. That's what we want to hear. We want to hear what's real.
I feel like a lot of clinicians go to self-pay for those reasons, those barriers and those complications, whereas others looking in, they're like, why aren't you taking insurance? It's like, well, actually it's the easiest thing to do, right? And there's another option of out of network and things like that, but or the super bill, but which they can take to their insurance. But we could have like hours of discussion about insurance.
This is probably a really long discussion.
Yes.
And I'm gonna this will be one I will break in. This for me is a panel discussion with some insurance people and administrators, and maybe, I don't think it's a legislator because they're not effective, but business people. I will get on. This is one I think we can at least understand what the constraints are on why that. Yeah, let's keep going. Sorry, I don't want to interject.
Yeah, Andrea, what you got, girl?
I'm kind of with you, LB. I think I probably complain to these guys at least once or twice a week about insurance ridiculousness that we deal with, and we're, I think, in a very privileged position. We're in a private practice. So I think, again, like from the outside looking in, there are questions about like, well, why can't you lower fees or offer maybe a lower sliding scale, or, take these other insurances? Here we really only take one, and it's the one that provides a halfway reasonable reimbursement. But even then you're having to, get on the phone and figure out, okay, well, why was this claim denied? Or, you can only give certain diagnosis, codes. And there's just a misalignment between what insurance wants us to do and what we know is best for our clients sometimes. And it's really hard to have to make the choice between getting paid and like performing best practices for your clients. Yeah.
Interesting. I wonder if part of this relates to the complication, because I would imagine the billing. I'm an insurance guy, so I have a unique insight into this. I would wonder if not your side, because I'm usually on the other side of your side. I was like, to clear myself of this crime, I'm a life insurance and health insurance guy. So I don't think we had therapy covered. But it's like this insane, the systems and the software that they're dealing with on the back end, and to try to fit these into the programs. And then, at least with medical, it's like, I have a scientific diagnosis here. This heart is showing these rhythms, and it's within this bandwidth, and that's this kind of arrhythmic thing, and they're going to get this pill, and this is the fee. You guys are dealing with a lot of like, it, could be, maybe, might be, right? It's not, you get a clinical diagnosis, but there's a lot in there. Is that part of it, you think? Is just they haven't figured out how to deal with you?
My personal feeling, and this may come across as cynical.
Yes.
I feel like from the therapist chair, we're thinking, okay, how do we sort of comprehensively like provide you with care for whatever you're experiencing? And so with
Yes.
something like complex trauma, you may need to be in therapy for an extended period of time. Like that's
For
not
your
something that
life.
you're going to work through potentially.
Your
I mean,
life.
I have so many clients that I've been seeing for years, and they are still getting benefit from coming in. We're still working on new things. That's just sometimes how long it takes to work through things.
Yes.
And I think when you hold that up to, an insurance company and you're trying to justify having, hundreds of sessions potentially with this one person, they're going, dude, like you should have had this cured by session 6 or session 12. Like, why are you still seeing this person?
Oh, well, they're
So
really
again,
nice.
yeah, we really love to chat. I really think there are some people sitting at the insurance company denying claims, thinking that that's literally what we're doing, is we're just sitting and like having a cup of tea and like chatting with our clients and just like shooting the breeze and not doing like really deep, difficult work. And like it takes the time that it takes. And I understand there's a cost to that. And I think the problem is they get tired of paying for it. And so, yeah, I mean, it's just hard to get on the same page there.
Yeah. Anytime you have a billing or a client like that, where it's on the extreme, where it goes very long, it always ends up on some report somewhere, right? These outliers.
Yeah.
And, and so at some point, as much as the clerk may want to pay it, they've got a manager, and then they convince the manager, and then by the, after it goes into 120, it goes whatever the number is, right? They're like, we have 4 people in the entire, 20,000 clients that are on 100th session. Why cut them off? Something, looks bad on our numbers. Who knows what the logic is? So it's okay to be cynical. For me, I never saw us ever in any of the companies I worked for ever have a policy of just denying claims or slowing claims. It was always about the whole business is to pay claims, is to instill confidence in the system. But that was life and accident and health, and this is a bit different, right? This is a lot of unseen stuff and unknown territory. Oof. It's going to be tricky, isn't it?
Yeah.
Yes. And I think that's where I'm at now. Just while providing that direct work, I realize how much research plays a part in whatever that, like for me, it's access to mental health, right?
Yeah.
So you have to prove and show, like we know these things, but we have to prove and show this on the books,
Yeah.
That's why I've not transitioned to it, but added it to my plate of like, you gotta show the research so that there can be. That's just how if it was my way. I mean, that is obviously the safest way, of course, but it takes years, to make.
Interesting. Very tough spot, right? Very tough spot. Okay, so that's a change. Anybody else seeing anything different on the government side or the insurance side, or any improvement or anything getting worse? Any other thoughts before I kind of?
Social workers can diagnose in Alabama now.
Really?
Yeah, that was, I guess, I mean, maybe a few weeks ago, I can't remember. I should know a specific day, but.
Well, that's pretty good, because you're now, comes back to my point of my question, which is, very difficult to put an actual diagnosis on something, like relative to a medical condition. And so here now they're saying, okay, you don't even have to be a doctor. We recognize your ability to say this person's in depression. Wow.
Yes, and that's great. So
that's great. That's like big.
Yeah, that's huge. Yeah, it is.
Would you have to refer somebody before for that? Like if
we just gave, it depends on what it is. We would give diagnostic impressions.
Yeah, impression. Okay.
Yeah, and then we would say, and we can't prescribe, of course.
Yes. Yeah.
That we'd refer out, but yeah, I mean, if it was like we don't, at least here, if you are filing for disability, we don't, we can't include that. Or we don't add, we'll support and help, get you the people you need to contact, with your experience. But yeah, I mean, we would definitely refer out depending on what it was.
Comments. I don't know if you're looking at the comments, but they are kind of bananas. We got some people. We're being. I think we got invaded by somebody from Greece and Milan. We got all kinds of people from all around the world, theoretically, or we got spammed. We got some. I think some of your friends are in here. We got some comments from people I think that know you.
Yes.
Yeah.
Andrea got a shout out from somebody.
That's Samantha. She is also part of the Hope Groves team.
Okay.
She's on maternity leave right now, so she's cheering us on.
Go, Sam. Oh, I love it. Well, we all need cheerleaders. Oh,
yeah.
Yeah, Sam, I agree. These ladies are great. What else? How about we go around? We're kind of like, this is the time. As short as it is, this is kind of cool. And I think for fun, thank you for this, because this will give me some insight how to do this. But I want to go around and give everybody kind of a closing, some closing thoughts. And maybe I'll give you some prompts, and then up to you, do whatever you want to do. But it could be just it could be a message to me for things to folks, something to look at. What I'm hot on the trail. I'm trying to learn. So what should I be looking at closer? Where do you think are places I can make an impact? Or a message to the audience, people listening, somebody else about therapy. Maybe somebody's listening and considering therapy. What's a message to that person? What's a message if we had a insurance person on the phone? What would be that one? If we could wave a magic wand with them, what would be the one thing or two things we could improve? Maybe not talking about turning water into wine. Is talking about turning a 10-page billing report into an email, something like that. So I'll let you. Maybe we'll go around. Let's.
Man, that's loaded, man. That's woo.
Well, I'm the host. I don't have to think of the answers. I just think of the questions I would not want to have posed to me.
Yeah, I guess I'll start. And
then let's finish with the boss.
Yeah. Yes. Perfect.
Let's let the boss have the last word.
So I guess for me is one of the most important things that I tell clients or just talk with clients about is to make sure you have a good fit with a therapist. Sometimes you go to a therapist and it was like the worst experience for whatever reason.
Really good advice.
Yeah. And so I would encourage people to, and we know it takes a lot of energy and resiliency and great, all the things to get you into the place or the virtual place there. So going through all that, just if it doesn't feel like a good fit, try to find another, because that's going to make rapport is the number one key to success. So I encourage people to do that. Know that and this is for me speaking, your therapist will not give you the answers. It's going to be a good sounding board because you are the expert as that person to help figure out those, help navigate that. So
I love that.
There's that. And then my always takeaway is that, you're not alone in what you're going through. And there are people out there who do want to support.
Beautiful, Elby. Ria?
Yeah, so kind of following up on what LB said, I think getting people into the door is absolutely the first step. Sometimes it's, doing the Google search or, calling to make an appointment, and it's very hard. And so I know that, and I really encourage people, even if it feels like it's impossible, like I don't have insurance, I don't know how much this is going to cost, but just putting feelers out there. I know I wasn't speaking up during the insurance talk because I don't accept insurance based off of my licensure currently. And so I don't have a hand to play there. But but I know it's really hard and it's really expensive. But I also know that if you call our admin, we are going to do everything to get you the
Yes.
resources to see, can we make it work within our practice. Like Andrea didn't really get to talk about Safe Haven, but we have a foundation that is serving this area. So I'll let her dive into that more
on the backside,
as a plug at the end. But we have some resources that we can provide, or we can refer people elsewhere. You know, the number of times that our group me or different Facebook groups that we're a part of will just be signing off with like, hey, I have a client that is looking for a psychiatrist in this area, or is looking for support groups in this area. Like, even if you don't come in to see us individually, we still want to help you and get you connected to where you need to be. So I think that kind of encompasses the like, find a good therapist, but also like, if therapy's not in the works for you, or this specific office isn't, we can get you connected somewhere else.
I love that. This is the key, right? Is just take that first step. Make, you know, if you're listening and, you know, you're not feeling your best in your head, get on Google, find somebody, just make a phone call. You'll figure it out. You'll figure it out. You'll find just the momentum will make you unstoppable on your road.
Yeah.
Anastasia.
Yes. So I guess my message to everyone out there is the importance of changing intergenerational patterns of behaviors and trauma, and to keep in mind that the way you are is because of the way you grew up, and that is not something that you easily recognize on your own, because it's your norm. And unless someone is saying, hey, didn't that sound a little bit aggressive, you wouldn't recognize that. But in order for change to happen, not just for yourself, but for your children's children and your children's children's children, for not just mental health wise, but medical and economic, you have to start somewhere. And it's all about the bigger picture, which is the generations to come and how you can make that change.
Yeah, Anastasia, the biggest, the brightest spot, the part that just gives me so much, you know, joy, not joy, I don't know how to describe it, just warmth or feeling good, is how many people I've interviewed on the jar who have stopped the generational shit.
Yeah.
And it's just so like, you know, I stand there, you like look at them and I go, you stopped it. It ended with you.
Right.
Like, yeah.
That's amazing.
It's not fucking happening at, you know, it stopped here. You know, it ended with my body and my mind. The shit that happened to me, done. It's not happening to anybody else. Or not from me outward. So powerful. I get chills just saying that story. You know, just how many times that's happened where I'm just like, fuck.
Yeah. It's hard. It's not an easy thing to do, to break that cycle.
You got to do the work, right? You got to recognize, you got to do the work, you got to grind it. So powerful.
Yeah.
Andrea?
Yeah.
Big boss gets the last word.
Oh, I hate that term. But
all right, the big dog.
Yes, I just cringes.
Well, hold on, you're in Alabama, so I don't know. I can't say biggest Razorback or something.
So just like to piggyback off of everybody else, you know, I think the big thing, like when you're really going through like the pits of it and it feels like, you know, things are hopeless and it's never going to get better. People get better all the time. Like people start out from exactly where you might be feeling like nothing is ever going to get better and everything is hopeless to, I mean, tomorrow, the next day, next month, next year, like you just make that phone call, or you even like submit a little online appointment request. Like technology is fantastic these days.
You don't have to talk to anybody. You just
exactly.
Ask. Yeah.
As an introvert, I can really appreciate that technology. I will avoid a phone call all day. So if you don't want to make the phone call, there are tons of places, us included. You can just like submit a little online request and never have to talk to anybody until you come in to talk to your therapist. So there are options out there. I think it can be easier than we tell ourselves, you know, when we're like down in the depths of things. And I think too, like, it can be really hard when you're hitting a lot of like systemic barriers and you're dealing with a lot of like just the awfulness of a broken system. It
Yes.
can feel like there's nobody out there that wants to be helpful, that cares about what you're going through. But there are so many people. I mean, there are so many just like amazing clinicians out there who want nothing more than to just like sit with you and be with you and help you through it and walk with you through it. And I'm not even just talking about, you know, at Hope Grows, just all over the place.
Yes. Yes.
So like what LB was saying, you know, take the time, find the person that's the right fit for you. I am a big proponent of like counselor shopping. So feel free, like ask for a consultation call, you know, or do a first session just to get their vibe and see, you know, if it's going to be a good fit, because that is like the biggest indicator of success in therapy, is you just feeling comfortable with your therapist. And then little final plug for Safe Haven in terms of accessibility. And this is only for Alabama, but I think there are a lot of these like nonprofit organizations out there, and a lot of the time they are teeny tiny. Safe Haven is a teeny tiny nonprofit that honestly I co-founded with, you know, one of my best friends back in like 2016, and we've just been like grassroots raising funds just to make counseling more accessible. So what Safe Haven does is it offsets the cost of counseling services so that the client can pay what's affordable to them. But on the flip side, the counselor also gets paid a living wage. And so that way everybody wins. So if you're in Alabama and you need help, you know, reach out to Safe Haven. We are happy to get you connected with somebody. If you're in like Tuscaloosa or Northport and you need help, reach out to Hope Grows. And like what Anastasia was saying, you know, it may be us, it may be somebody else, but we'll get you hooked up. You know, we're happy to provide resources. And I find that true of just about every counselor that I know. You know, if you're scared to make a phone call, or you're scared to make a lot of phone calls because you don't know who's going to be the right fit. If that person feels like they're not going to be the best fit for you, they're going to tell you on the phone. And they're probably going to have some recommendations for other counselors in the area that would be a good fit for you. We all know each other. So, I mean, just make that initial phone call. They'll be able to tell you about, most everybody does sliding scale fees, you know, and then there's nonprofits like Safe Haven. So there are just a ton of options out there. So the thing is just kind of taking the first step. That's often the hardest step, but if you can do it, it can make a world of difference.
I've seen proof. I'm not, I mean, I can honestly say I would be one of those people who would have said, yeah, you ain't going to see me in front of sitting on anybody's couch. Ain't happening. Not an option. But I can see the work that's been done with people, and I've heard the testimonies over and over and over again. So for me, it's a no-brainer. You know, if you're feeling it, make a phone call. Hardest phone call you're going to make. I think for some people, to really pick up that phone. And I mean, asking for help is a tough thing to do. And I think certainly the stigma around it as well doesn't make it easier. And then if you're worried about shit, I can't even afford a therapist anyway. You end up in just coming back inside yourself. I did want to show the Adam Project as well. This is the adamproject.org. This is one I mentioned earlier. Andrea, you might not have been on the call yet. But this is basically a project which has free resources. Now, there's no free therapists on there yet, although he has found some therapists which are donating time. I don't think it's on the project yet, but this is another resource. So if you're afraid to make the call, but you want to dive in and ask questions, this is a great place to go and poke around. A lot of stuff has been put on here, and well motivated by a friend who lost somebody to suicide, which I've seen a number of people really pour their hearts into this kind of stuff. It's amazing what, you know, it's kind of weird when your life is tough and you take that choice to self-harm and you're gone, the impact it has on everybody else, enough to where people quit their careers, change their lives. So what happened to their friend never happens to anybody else. It's just wild. The human condition of motivation, right? Like that hurt was so bad for me because they left, and I can't imagine the pain they were going through. So I got to do something. I'm gonna change my whole career and throw all my money into this banana thing that I'm probably never going to make money at, because I want to do this. I just like, wow. And I've met quite a few people on this show that have done that. It's just so inspiring.
Yeah.
Thanks everybody for y'all were great. This was so much fun. And I think anybody listening would have gotten their money's worth. You know, a little bit long. We're a little bit over, but I think for the size of the crew, first time through, I really appreciate it. And thanks for experimenting with me. I really appreciate that. LB, thanks for setting everything up.
Yeah, absolutely. Thanks for providing the platform to be able to do this.
Yeah, and to get some of your ideas out there, and I'll take this to heart on a couple of things. I got some noodling to do and take away. Stick around. We're going to do a little commercial. I got one more commercial to run. Thanks again, everybody, for listening and supporting to the Mental Health Today show. This is really, I think, an important project, and I'm just excited to keep interviewing great people, great professionals, dedicated their lives to the crisis. And you can do some too by sharing and liking and comment and following, all that good stuff. Thanks again. I'll see you on the other side.
All right. Bye.
Bye.
Thank you.
Bye-bye.
Thank you.
Yeah, loose, baby.
We're about to go and make this vessel with these great professionals at Public Glass. We're not part of the community, but we're from the outer family of glassblowing. Yeah, we're going to go make a magical giant jar with optic lenses so that if you turn it, it changes all the time. So if you change the way you look at things, the things you look at change.
Eye to eye with a man.